There's a silent truth that many men over 60 rarely talk about, and that's sexual health. Society may try to tell you that once you hit a certain age, passion fades, drive weakens, and pleasure becomes a distant memory. But let's set the record straight. Your desire doesn't retire just because you do. Your body changes, yes, but your need for intimacy, for connection, for that spark of vitality, it remains, strong and alive. The key is not to suppress it, but to understand it and nurture it safely. Masturbation, when done right, is not just a private act. It's self-care. It's about keeping blood flowing, hormones balanced, and confidence alive. But after 60, the body isn't the same as it was at 20 or 40. The skin is thinner, the prostate more sensitive, and blood vessels a bit more delicate. That means you've got to approach it smartly, with respect for the changes your body has gone through. Let's start with the first dangerous mistake: using excessive pressure or force. Some men think more intensity means more pleasure, but in reality, this can lead to micro tears, bruising, and even nerve damage, especially when blood flow isn't as strong as it used to be. Gentle touch is not weakness. It's wisdom. Your body responds best to rhythm and patience now. It's about sensation, not speed. Use lubrication, water-based or natural oils, to protect the skin and enhance pleasure. Think of it as upgrading the experience, not slowing it down. The second mistake: dealing with diabetes, high blood pressure, or taking certain medications, your body may respond differently. The solution isn't shame, it's awareness. Talk to your doctor, especially your urologist. They can guide you toward safe practices, offer suggestions, and even help you explore new ways to experience satisfaction. Remember, knowledge is power, and in this stage of life, power begins with information. And then comes the third and most underestimated mistake: guilt and secrecy. Too many men feel ashamed for still having sexual desires. They think, "I'm too old for this," or "people my age shouldn't feel this way." But let's be honest, sexual energy is part of being human, no matter how many candles are on your cake. Suppressing it leads to frustration, anxiety, and even depression. The goal isn't to eliminate desire, it's to express it in healthy, mindful ways. Masturbation is one of those ways, provided it's done safely, without obsession or pain. So how do you do it right? You honor your body. You slow down, breathe deeply, and listen to your signals. You use the right environment, the right tools, and the right mindset. You don't rush it. You savor it. You see it not as an act of shame, but one of self-respect and care. Because when you take care of yourself sexually, you take care of your heart, your hormones, and your happiness. Let's be real. Aging doesn't mean you stop being a man. It means you become a wiser one. A man who knows his limits, honors his needs, and refuses to let fear or judgment dictate how he lives. The world may not talk about it, but the truth is this: your pleasure is your responsibility. And learning to embrace it safely, especially after 60, is one of the most empowering things you can do for yourself. You've spent decades taking care of others, building, working, providing. Now it's time to care for you. Safe, mindful, and confident. Because you deserve a body that works with you, not against you. And a mind that knows pleasure isn't a privilege of the young, it's the birthright of the living. As men age beyond 60, their bodies undergo profound physiological and hormonal shifts that influence nearly every aspect of sexual health, including the way they experience arousal, pleasure, and self-stimulation. This is not something to fear, but something to understand. Knowledge of these changes is power, and power leads to control, confidence, and fulfillment. The truth is, masturbation after 60 can be deeply satisfying, even transformative when done with awareness and care. But it all begins with understanding what's happening inside the body. Let's start with hormones, the silent orchestra that controls sexual desire and performance. Testosterone levels naturally begin to decline with age. By the time a man reaches 60, his levels are significantly lower than they were at 30. That doesn't mean desire disappears. It simply means that arousal might take more time and more stimulation. You might not feel that instant fiery spark you used to, but the flame is still there. It just burns differently, slower, steadier, and often more emotionally connected. Recognizing this helps you shift from a performance mindset to a pleasure mindset. Another major change comes from blood flow. Erections depend on healthy circulation, and as arteries stiffen and blood vessels narrow over the decades, achieving and maintaining firmness can become more challenging. It's not about weakness, it's about physics. The heart has to work harder to push blood where it needs to go. This is why gentle, consistent stimulation and proper relaxation are key. Rushing or forcing arousal can backfire, creating frustration and anxiety instead of enjoyment. You're not in competition with your younger self. You're learning to cooperate with the body you have now. Then there's sensitivity. Many older men notice that their skin, especially in the genital area, becomes thinner and more delicate. Repeated friction without proper lubrication can cause irritation or even small tears, which can be painful and take longer to heal. Lubrication, once optional, becomes essential. It's not a sign of aging, it's a sign of smart self-care. Think of it as giving your body what it deserves, comfort and respect. A water-based or natural oil lubricant can reduce friction, protect delicate skin, and make every touch more pleasurable. Hormonal changes also affect the prostate, a small gland that plays a big role in male sexual health. With age, the prostate often enlarges, a condition known as benign prostatic hyperplasia, BPH. While it's common, it can lead to urinary issues and affect ejaculation. Some men find their orgasms feel weaker or shorter. Others experience a change in the volume of ejaculation. None of this means pleasure is gone. It just means your body is signaling a new normal. Understanding these signals allows you to adapt your technique, take your time, and still experience satisfaction without strain. The nervous system also evolves. Nerve endings, stress, loneliness, and anxiety can block arousal more effectively than any physical limitation. After 60, the key to pleasure often lies in creating the right mental space. You need calm, privacy, and an open attitude toward your body. Meditation, deep breathing, and mindfulness can enhance sensitivity and pleasure, making the experience more fulfilling than ever before. It's also important to note that medical conditions like diabetes, hypertension, or heart disease, which are more common after 60, can impact sexual function. These conditions affect blood flow, nerve sensitivity, and stamina. That's why it's essential to maintain a healthy lifestyle. Regular exercise, balanced diet, and medical checkups all contribute to better sexual health. Masturbation itself can even be beneficial, improving circulation, reducing stress, and helping maintain erectile function. So, when we talk about masturbating safely after 60, it's not just about avoiding harm. It's about working with your body instead of against it. It's about understanding that pleasure evolves and that maturity brings depth, patience, and connection that youth rarely knows. The body may age, but the capacity for pleasure, intimacy, and confidence doesn't fade. It transforms. In this stage of life, sexual health is not about performance or ego. It's about vitality and self-respect. When you understand your body, you stop fighting it and start honoring it. That's the foundation of safe, fulfilling self-pleasure, a practice rooted in wisdom, awareness, and a deep appreciation for the miracle of still being alive, vibrant, and capable of joy. Now that we understand how the body changes after 60, let's talk about the second key idea: avoiding the 3 most dangerous mistakes older men make when masturbating, and learning how to do it safely, confidently, and wisely. Because let's be honest, no one teaches this. Most men learn through experience, often decades ago, and never update their technique to match their body's evolution. But after 60, ignoring these changes can lead not only to discomfort, but also to real physical harm. So let's walk through these mistakes one by one, and more importantly, how to replace them with better, safer, and more satisfying habits. The first mistake is using excessive pressure, friction, or intensity. Many men, out of habit or impatience, grip too tightly or move too fast, trying to force an erection or chase an orgasm. But after 60, the body's tissues are more delicate, the skin thinner, and blood flows slower. Too much pressure can cause microtears, bruising, and in some cases, nerve sensitivity loss. It's like revving an old engine without warming it up. It doesn't make it stronger, it just causes wear and tear. The fix is simple but transformative. Slow down. Use lubrication generously. Let arousal build naturally without forcing it. Gentle, rhythmic motions stimulate more nerve endings, encourage better blood flow, and prevent strain. Think of it as tuning into your body's rhythm rather than overpowering it. Pleasure at this stage of life isn't about speed. It's about connection and awareness. The second mistake is ignoring underlying health conditions and medications. This one is critical. Many men over 60 take medication for high blood pressure, diabetes, or heart disease, and these can affect blood circulation, nerve response, or even libido. For example, beta blockers and certain antidepressants can reduce sensitivity or delay climax. Diabetes, especially if uncontrolled, can damage the nerves involved in erection, and prostate issues can affect how ejaculation feels or occurs. Yet many men don't connect these dots. They think something is wrong with them, when really it's their medication or health condition playing a role. The solution? Awareness and communication. Talk to your doctor or urologist. Be honest about what you're experiencing. There's no shame in discussing sexual health. It's a vital part of your overall well-being. A professional can adjust your medication, suggest safer techniques, or recommend exercises and therapies that enhance blood flow and sensitivity. Taking care of your health isn't just about living longer. It's about living better, with pleasure and confidence intact. And then comes the third, most underestimated mistake: guilt and secrecy. This is the emotional trap that keeps so many men silent, frustrated, and disconnected. Society has done a poor job of teaching older adults that sexuality doesn't have an expiration date. Many men internalize shame. They think, "I'm too old for this," or "people would judge me." That mindset is not only unfair, but deeply damaging. Sexuality is part of being human. It's tied to hormones, mood, confidence, and identity. When you suppress it, you create emotional blockages that can manifest as anxiety, irritability, or even depression. Safe masturbation is not immoral. It's maintenance for both the body and the mind. It releases stress, improves sleep, boosts endorphins, and even supports prostate health by improving circulation. The real danger isn't in the act, it's in the shame surrounding it. So how do you replace these 3 mistakes with healthy, empowering practices? Start by creating the right environment, a calm, private, and comfortable space. Use the right lubrication and take your time exploring what feels good now, not what used to feel good years ago. Your body's preferences evolve, and that's natural. Stay mindful, breathe deeply, relax your muscles, and stay in the moment. If you experience pain, numbness, or discomfort, stop and rest. This isn't a race. It's an act of care. Next, pay attention to your overall health. Eat well, exercise regularly, and prioritize circulation. Walking, swimming, or yoga can improve blood flow and help maintain erectile function. If you smoke, cut back or quit. If you drink heavily, reduce it. Every lifestyle improvement you make supports your sexual health too. And don't forget hydration. It affects your body's natural lubrication and energy levels. Finally, embrace a positive mindset. Let go of the myths that aging kills pleasure. The truth is, many men find this stage of life brings better pleasure, deeper, calmer, and more emotionally fulfilling. You're no longer driven by impulse. You're guided by awareness. Masturbation becomes not a secret habit, but a celebration of vitality, proof that you still have energy, passion, and the right to feel good in your own skin. So, when it comes to safe self-pleasure after 60, remember, gentleness is strength. Awareness is protection, and confidence is medicine. Avoid the pitfalls of pressure, neglect, and guilt, and instead choose connection, care, and respect for your body. Because your pleasure doesn't belong to the past. It belongs to the present moment, where wisdom meets desire. And every heartbeat reminds you that you're still very much alive. At the end of the day, The message is simple but powerful. Pleasure doesn't age, it evolves. Turning 60 or 70 doesn't mean your days of intimacy are behind you. It means they can take on a new, more meaningful form. The key is learning to work with your body, not against it. Understanding your physical changes, respecting your limits, and approaching self-pleasure with care and confidence turn what some see as a taboo act into an act of healing and empowerment. Your sexuality is not something to be ashamed of. It's part of your health, your energy, and your emotional balance. You've earned the right to live without guilt, without fear, and without apology. When you take the time to listen to your body, use gentle techniques, and create a safe, private space to reconnect with yourself, you're doing far more than just maintaining physical function. You're nurturing your self-esteem and vitality. Remember, the 3 biggest mistakes, excessive force, neglecting health, and carrying guilt, can rob you of joy and comfort. But when you replace them with patience, awareness, and self-respect, you unlock a new chapter of satisfaction that's mature, confident, and deeply human. You begin to see that pleasure isn't just for the young. It's for anyone who chooses to honor their body and embrace life fully, no matter their age. So, to every man over 60, you are not past your prime. You are in a phase of mastery, of understanding, balance, and wisdom. Safe self-pleasure is not weakness. It's self-awareness. It's proof that you value your health, your happiness, and your humanity. Treat your body with kindness, your mind with compassion, and your sexuality with pride. Because aging gracefully isn't about giving up. It's about continuing to live, love, and feel with all the depth and dignity you've earned through a lifetime of experience.